Tana shimle nalai bazar punamle yari ate nalai pasatane nalai paramasi pashacho yarame nale chu tana makang nalai turigunla kopas puni sanlai
Well, we're in the Nubra Valley, a historical station on the ancient Silk Route in a disputed area in the Great Game strategically between India and Pakistan and China.
Nubra is quite a big area, area-wise. We have around 40 villages in this valley, and the population-wise we have 10,000 in this valley itself. Now, the problem about this valley is it's locked. There's only one way to get out of this valley.
And unfortunately, one that the limited resources of the Indian medical infrastructure very seldom reaches.
This is the only hospital in this valley, and there are villages which is quite far away from this hospital, and they have to walk all the way from their village.
Oftentimes, the physicians, the very limited physicians, like in this small hospital in Diskit, only see those patients after the condition has reached such a critical point that it's almost unsalvageable.
Eye problems are quite common because of sunlight. The sun is so bright here, and you have this UV lights which is damaging your eye. Sadly, we don't have a good ophthalmologist out there in Ladakh. So now most people they don't get operated.
Another immeasurable aspect of this is the credibility that has now been established with the team that came last year with Dr. Elliott. We made a lot of promises about returning and addressing some of the health situations, primarily the cataract conditions that were discovered last year.
And so that's the reason we brought 2 eye surgeons. And eye surgery is a very complex thing to do. So we've had 4 of the nurses helping to run the OR because it's very, very high-tech work.
But we've been seeing both cataracts as well as a whole bunch of very serious eye problems, blinding conditions, as well as minor problems. So we've been seeing the whole range of eye conditions. And he had a very dense cataract. So, he's the typical patient that we really want to help. And he, when he came, he had to be guided, because he was totally unable to function. First of all, we have to give a local anesthetic around the eye, and it paralyzes the muscles of important muscles of the face, so that when we operate, the eyes cannot close down. And then we make an incision on the upper part of the eye. And then we just cut the front of the lens so that the contents of the lens can be expressed. So we put an implant, an artificial lens in, and with that, he should be able to see fine. He's very short.
So then after that, we just stitch up this area. So that's how we do it. The dentistry, we know, everywhere in poor communities, they may get a bit of health care in all sorts of other situations, but not dentistry, not good dentistry.
Well, as you can see, we're pretty busy. We've got seen about maybe 5-6 cases just now. Fillings, extractions, some root canal treatments.
We've saved teeth, and we've also educated the children not to eat so many sweets, and we've brought a whole lot of toothpaste and all that. So that's very good. Lots of people have medical problems, aches, pains, joints not moving.
It's amazing that everybody over 50 or 60 years old has osteoarthritis, severe knee pains, severe degenerative changes in the knees. If you know the terrain of the country and you know the type of work they do and the amount of weight they carry every day, it's amazing.
So the medicals, we have 3 physicians, one of whom is a specialty in dermatology.
We have lots of skin diseases, and there's lots of fungal infections, scabies. That's quite common. The reason for that is, again, like the hygiene condition is not good.
Ask her to take this to the pharmacy and Pretty will settle it.
The gynecology has been a very successful inroads into the cultural restrictions of women's health care.
Cervix cancer is a major problem. I mean, it is the biggest cancer in rural India.
When it starts, when the cancer starts, it's a small area.
At the start of every day, we got the women together trying to explain to them what screening is about. The whole concept of screening is very, very foreign because nobody would think of visiting a doctor unless they felt unwell.
So they wanted to introduce this concept that you can cure the pre-malignant lesions. And as a result of it, I mean, from this week we found out it was a very high level, 25%, which they could treat straight away.
And this morning we had a breakthrough. We had at least 5 or 10 patients who came in who had absolutely no symptoms, who just wanted to be screened, and it took 4 days to do that.
In such a short span of time, we have seen so many patients.
Actually, it looks chaotic, basically. That's the only word I can explain.
The numbers, as you can see, are absolutely overwhelming. There's an urgency. It's not a greed. There's an urgency in the air.
Most of them are very hopeful that they will get treated right by the foreign doctors coming here. A few have come from 80 kilometers, 90 kilometers, and so you feel that you should treat them because they're going back to a place where they might not have doctors. So we are trying our best.
The most touching part of the morning rounds, especially today when they know they're going to be discharged, was the fact that they were squeezing our hands and they were giving blessings to us, and they were so happy that they could see the family members after such a long time.
I've talked to many patients who got the treatment here. They are so happy. In Buddhism, there's we have something called Bodhisattva. Bodhisattva means a person who always help others, and they have just one word for all the team members here, that they are all at Bodhisattva.
very grateful for whatever we can do. They have a lot of problems, and although we can only do very little, we have a lot of limitations. Despite that, it's great to see how appreciative they are of what we do.
I find the people I delight to work with, they're so appreciative, and it's really an eye-opener for me, who have been working in a very advanced environment.
I feel they're very genuine people, and they parents really love their children, and I really like that. I can see the faces on mothers and their children, and that's always a good sign of a society. They really love their little children.
Thank you.